Hi, I'm Dr. Jake. I'm the chiropractor here at Root Cause. Today I want to take you through the science behind chiropractic adjustments. Now, if you've been to a chiropractor, you know it's therapeutic. It feels good. A lot of times you feel better immediately afterward. And that's from releasing of some enkephalins through the spine that help you feel the pain a little bit less through putting the joint through the full range of motion, which help you move a little bit better. But it's also about restoring proprioceptive function. That's sometimes more important long term than anything else. Proprioception is the brain's mapping of the body, where it is, where everything is in space. The reason you can close your eyes and still move your hand around and know where it is relative to the rest of your body is because of proprioceptors and all your muscles and all your joints that tell the brain when things are stretching, when things are moving, how fast, how far, and that's super important, obviously. Now, the spine is where these proprioceptors are most densely packed more than anywhere else in the body. The reason for that is the core, right? It's the base from which everything else is related to. So you can't know where your hand is if you don't know where your spine is. When we have, joint dysfunction, if we have a joint that isn't moving properly or isn't moving at all, then the brain is either getting dysfunctional signals from the spine or it's getting no signals from the spine. So you have a blank spot here. And that can cause issues not only in that joint, what we call microtraumas, because if that joint is continuing to move incorrectly, it's going to damage the joint. You can get pain, you can get degeneration, you can get disc issues, disc herniations, what have you. Obviously really important to the spine that this stays moving properly and the proprioceptive function stays high. But it's also important for you, the movement of your extremities. So that's why sometimes adjustments of the neck can help with shoulder pain, adjustments of the low back can help with knee, ankle, right? It's all part of a chain of function. So it can be more important than just going to the chiropractor and getting some back pain relief. If you have chronic knee issues, ankle issues, that could be a reason to go to the chiropractor. And it's also important to prevent this joint dysfunction, right? You may have dysfunctional movement in a joint for months, years, decades before you get any pain or arthritis or anything like that. And so that's why it's important to see a chiropractor regularly to get the spine adjusted, to keep the spine adjusted, and keep everything moving properly.